Hey, everybody, welcome to Functional Yoga Medicine. And this is Dr. Connie Chung, your host. And today I want to talk to you guys about the fact that there is no one size fits all treatment protocol for your patients. Most of you guys are practitioners of health one way or another, whether you're a yoga teacher, a fitness instructor, physician, physical therapist, occupational therapist, or a nutritionist. It doesn't matter, but in any given specialty in the field of health and medicine, there tends to be a one size fits all approach for specific conditions and ailments. And whether it be the medications, recommendations, or prescriptions, or even surgery, the one size fits all approach makes sense when we treat with a specialty in mind. That means being a nutritionist, doing what I do, and with that specialty, only think that nutrition is the way. Or being a physical therapist, doing physical therapy, and only thinking we can only modulate through physical therapy alone, right? And if you're a physician, you're used to prescribing medications, and all you think about in regards to your own specialty. And so when we get so focused in our own scope of practices that's so specialized, and we have many different ways of treating things to a point where, in the field of holistic medicine, there's different divisions, right? There's acupuncture, it's effective. Well, what's the difference between acupuncture and trigger point dry needling? There needs to be an explanation for that. Both are very effective tools, I believe. The premise is a little different, but really the needle and the use of needles to the consumer, there's no difference to them, but we know as practitioners, there's a significant difference. They can be complementary. It's not threatening to one another, but yet there's a lot of scope of practice issues within the dry needling and acupuncture because they want to take away the rights within their profession, right? And when we are bickering with each other as to what's more effective, what's our domain, like chiropractors and physical therapy, high thrust manipulation versus, adjustments, for example, right? Like we can't use certain terminology, but in essence, it's pretty much the same thing when you're moving the bones in place, right? And these are things that we bicker and fight about within the domains, and it really shouldn't matter. And because all things really, what we're trying to do is to really help our patients, not to say, I'm the only way, I'm the best way, and that's it. We get very dogmatic when we start to defend our limitations or professions. And that's not the way I want things to be, because from a patient perspective, because you guys all know, I've lived with an autoimmune condition. So I've had to really make sense of all the specialists out there to see which ones suited me, which ones didn't, and to make sense of why and the premise and understanding of how it would help my body was super important. And it doesn't help when the practitioners are bickering with one another about the validity of their treatment approach. So with that being said, I want you to understand that there are no certainty and there are no absolutes when it comes to healing. There is a variable that you guys fail to sometimes consider, and that is the patient as a variable. Their background, their life circumstances, their emotions and thought processes, but most importantly, their beliefs about who they are and the way they see the world, that will determine that mixed in with your recommendations and your knowledge. And there's variables there that clash and everything needs to fit. And then on top of that, there's layers, and then there's confounding variables that pretty much multiplies within the realm of healing with each and every one of the patients. So you have to understand that what we're doing is to make sense of all the layers and the variables. But more importantly, we want to really address the variables in a way that is specific to that patient. And that means honoring that patient. And at the end of the day, all we can do is to empower them to heal themselves. We have the information to guide them and to mentor them, to question them and to coach them in the right direction. And that takes skill set. And it doesn't mean we make something right and wrong, because there is no right and wrong when it comes to healing. We have to really embrace all aspects of healing, the Eastern side, as well as the Western, the scientific side, as well as the miraculous side, while honoring their individual differences and preferences and all the adaptations and really the conditioning that comes with each and every one of our patients. And that's why there is no one size fits all. And yet in school, we're taught one size fits all approach, generally textbook approach, and then we're supposed to figure it out clinically. For those of us who veer and we're willing to be a little explorative and daring in our clinical field and expertise, we're able to gather some of that. But those of us who stick to the rules and regulations, I'm afraid that those are going to be quickly outdated with all the AI coming into the surface and all the technological advancements that's connecting everybody and the information that's available to everybody. And so today we have layers and layers of variables and confounding variables that we can't just pinpoint one type of food, one type of diet, one type of supplements, and a specific lifestyle or or anything like that to dictate. It all needs to marry and mesh with each and every one of our patients who have individual differences and so many different variables to consider, that if you're a practitioner who feels like they know it, I'm afraid that that's the wrong approach, or I shouldn't say wrong, that is not the best approach when it comes to helping your patients to heal. So for me, it's all about a complex piece of the puzzle, or complex puzzle that we're trying to solve. And without knowing what the outcome, the final product needs to look like, we just hold on to each of our puzzle, afraid to come together interdisciplinarily and to give in and to align with each other for the well-being of the patient. And the well-being of the patient is a complete puzzle, because the pieces of the puzzle and our ego that goes along with that puzzle and having dominion over that piece of the puzzle is all we're doing in the field of medicine and wellness. Whether a yoga teacher, Pilates instructor, we argue over which one's best. Personal trainer, CrossFit, we argue over that, right? There's differences even within the field of yoga. There's Ashtanga yoga, there's Hatha yoga, there's Vinyasa forms of yoga, there's hot yoga, there is warm flow yoga, whatever the case might be. And even in the field of medicine, we tear the body apart endocrinologically, GI-wise, neurologically, immunologically. There's specialists for just about every body part. But unless we clarify the big picture and how this must look for the patient, we will never be enough and make significant impact in the lives that we're trying to make a difference in. And so that's why I created the Alkaline Method for practitioners. It's a way for us to really understand really ourselves as well, the inner awakening as human beings. The importance of that is the first element, the foundation by which everything builds on. And then the second component is all about outer manifestation, right? It's all about our thoughts creating our results in our lives. Look around. This is what we're creating as the creators that we are. And then from that place, once the foundation is strong and primed for health and healing, then we can amplify the modern medicine, which is the third element of the alkaline methodology, which has three essential components, which is stress brain, and then there is the gut brain, and then immune brain. And then as long as we can align those optimally, then you have perfect health. And then we have ancient wisdom, where we practice what we preach through the practice of yoga, breathwork, meditation, hypnosis, and applying energetic medicine to understand that what we think is what we create, and really how much control we have over our own vices, our own body, and our own thoughts, feelings, and actions, and the results in our lives, despite the circumstances of our lives, is the key element of everything coming together in the alkaline methodology for practitioners. And so that's what I wanted to emphasize today. the fact that there is no one size fits all. And I'm praying and hopeful that many of you as practitioners, if you have the heart and passion to really truly help those that you serve in the most profound and impactful way, there is a better way for you to tune in, first of all, to yourselves and check yourselves and optimize your health and go through your own transformation, because we all come to the table with some sort of trauma, conditioning, and all the baggages and skeletons in our closets that we try to hide. But it's only when we can be forthright and really be confidently ourselves, unapologetically, and know clearly what that is, that we can succeed. Sorry for that little interruption. Thank you so much for joining me today. And if you haven't done so, please subscribe to our podcast, Functional Yoga Medicine. You can find me on Instagram at Dr. Connie Chung. I hope you can find me there. And I really want to thank you for being here and being able to listen to this podcast, especially this episode, which is really, really personal to me. And so thank you, and I will see you guys all next week.